Hello everyone. Today I'm going to discuss on the topic how to study pharmacology for NCLEX. So are you guys ready to go with me? Let's begin our topic. What we study in pharmacology? Mainly you need to study about two different kinds of medicines, which is herbal medicines and pharmaceutical medicines. Similarly, uh, what you need to study about the herbal medication? Mostly asked questions about the herbal medications are nursing considerations, side effects, interactions with other drugs. Most of the time in entrance examination, the interaction of herbal medication with pharmaceutical medications are asked. In herbal medications, there are maximum herbal medications which are used, but you need to know about the most common type of herbal medications which are used among the people. And those are ginger, garlic, ginkgo biloba, ginseng, Saint John wort, saw palmetto, etc. There are others medication also, but this those are the most important herbal medication which are most commonly used and it is most commonly asked during your NCLEX examination. So what you need to know about the herbal medication? Uh, for example, I've listed about the Saint John wort. You need to know about these drugs with which it interacts with. For example, it interacts with the drugs like theophylline and tetracycline. And what does it do? It causes serotonin symptoms like dizziness, dry mouth, photosensitivity, and so on. You also need to know about its uses. Why is St. John wort used? It is used to treat menopause, depression, attention deficit hyperactivity disorder, and bipolar disorder. So, if the patient is having any kinds of psychological disorder and if they are taking SSRI, TCA, MAOIS along with St. John wort, it may interact, which may lead to various kinds of side effects and uh, that may cause different types of effect among the patient. So what types of question is asked during the examination? Here I have enlisted one example. A nurse is caring for a client who is taking St. John wort for depression. Which of the following potential nursing diagnosis for this class client? So at first you need to know that St. John wort causes what? You need to know its side effects, its causes, and its interaction. So what would be correct answer in this question? Let's go towards this. Knowledge deficit related to need to avoid cysts. So at first you ask question to yourself, do the patient who is taking St. John wort really need to avoid cysts? No. So this is wrong answer. Similarly, in question answer number B, knowledge deficit related to need for low sodium diet. Does the patient who takes St. John wort for depression really need for a low sodium diet? No. So this is also not the correct answer. And another answer is knowledge deficit relating to the increased risk of hearing loss. St. John wort, St. John wort, the patient who is taking St. John wort for depression is not at increase in risk of hearing loss. So the correct answer is the side effect of photosensitivity. We need to know that St. John wort causes serotonin syndromes like photosensitivity, which is increasing sensitivity to light. So the correct answer of this question would be knowledge deficit related to the side effect of photosensitivity. Is it clear? Now let's go towards the pharmaceutical drugs. Um, there are maximum pharmaceutical drugs enlisted in our Saunders book. So most common, you need to know about the most common types of drugs which is asked during the examination, like anticoagulants, heparin and warfarin. There are other anticoagulants also. Anticonvulsants like phenytoin, anti-anxiety like lorazepam, diuretics like furosemide, torsemide, spironolactone, antihypertensive drugs like enalapril, losartan, similarly NSAIDs. You need to know about such common types of drugs. There are other drugs also, but in this slide I've included only few types of drugs. Similarly, what you need to know about the pharmaceutical drugs is its side effect, its nursing considerations, contraindications, and indications. Similarly, what you need to know about the drugs is drug toxicity level, antidote, its mechanism action also. For example, here I have included about ranitidine. Why is ranitidine used? Ranitidine is used in order to turn the volume of the acid, which act as a H2 receptor antagonist. Uh, so during the NCLEX examination, they might ask you about the nursing consideration while giving ranitidine. So you must know about the nursing consideration of common drugs. Uh, just like in ranitidine, the most common nursing consideration you need to follow is you must give ranitidine 30 minutes before meal. No stress, no overeating, no smoking, and no NSAIDs with ranitidine. During examination, this type of question is also asked. You are preparing to administer warfarin at 17. Which lab report to question whether you should administer this medicine or not? Sodium, potassium, hemoglobin, and iron. Warfarin, it is used as anticoagulant. That means you need to look after the INR value. In this patient, the INR has increased. As you know that the level of INR is 1 to 2. So increase in INR, if we give warfarin, then what it leads to? It leads to increase in leads. It leads to increase in risk for bleeding. Therefore, you must question because as you see, there is increase in level of INR value. So, what are the different resources you can use to study pharmacological tips? There are maximum resources, but I suggest you to go towards the simple nursing video. It is one of the best resources you can use for studying pharmacology. They have explained in so good way that it will help you to study pharmacology in an easy way. You should also go through mark your audio and notes. It will gives you brief knowledge about the pharmacology tips you need to go through. Similarly, for drugs and dose calculation, you can go through Saunders' book. And for question practice, you can go through Arbor. Most apart from pharmacological are, as I have already told you, drug calculation, formula for drugs conversions, normal levels for toxic drugs, and antidote. They are most commonly asked during examination. Lastly, if you want more details, stay updated through my YouTube channel and Facebook page. If you need one-to-one classes for individual topic, please comment down so that we can get connected to each other and plan for next session. If you need my personal PDF file and resources on individual topic, please let me know. And I would like to make it clear that certain charges will be taken for PDF file and personal classes. As you know, if everything comes for free, it would be less valuable. And I would like to tell you, if you have any queries regarding NCLEX topic, if you need any kinds of tips and tricks, please comment down so that I can upload video regarding those topics. Thank you so much.